Good afternoon, everyone, and thank you for joining us. I'm Zara Arboleta with Valley Children's Healthcare. This is the latest in our ongoing series, our virtual health series for families and our kids. And today's topic is COVID-19 and asthma. And we're joined today by pediatric pulmonologist, Dr. Lauro Roberto. Dr. Roberto, good afternoon. Thank you for joining us.
Thank you, Zara.
So we last had one with Dr. Niall Mason. We had one of these segments, and he's our medical director of pediatric infectious disease. And we received so many questions from people on Facebook and Instagram directly related to respiratory conditions and COVID-19. So we thought we better bring you on board to talk about this specific topic because so many parents are worried about this. So Dr. Roberto, I know that you wanted to speak a few words for folks who are watching us right now on Facebook, and a reminder to all of you who are watching at home, in the comments, feel free to ask your questions there and we will get them to Dr. Roberto.
Well, first of all, I know that since early part of this year, we've been battling this big COVID-19 pandemic. And I know that the initial data, which mostly has affected mostly the adults, have shown that the disease itself has been affecting people who are older and also patients who have had other comorbidities or other underlying diseases to be worse. And I know that most parents are also concerned because some of their children also present some of these comorbidities. And since I'm a pulmonologist, one of the questions I've always asked is how does asthma or how does COVID-19 affect my child with asthma? And so going with that, I know you've had lots of questions to ask me, so I'm here. We'll try to go over and answer each and every one of your questions.
Well, you already touched on the number one question from people. How does COVID-19 affect children with asthma and other respiratory illnesses?
So it's interesting because there are two questions really that I always see. Is one, whether if I do have any of these comorbidities like asthma or other respiratory illness, will that make me predisposed to get COVID-19? And if I do, will that affect me in a much worse way? So for the first question, really, the exposure or the risk of getting COVID-19 is the same for everyone. And again, the exposure, of course, if you're exposed, regardless of whether you're healthy or not, if you're not taking any precautions, then the risk is that you will get COVID-19. The important question I think that people are asking is, well, since I have asthma, how is that going to affect me? So interestingly enough, when we had some of this data that come from Europe and also from here in the United States, it seemed that some of the patients who have been admitted or are more critically ill do have underlying conditions almost similar to the older population. So the most underlying condition that they've seen, of course, is asthma. They've also seen patients with heart issues and also neurologic issues who also have been admitted because of asthma. So it seems that getting this, what we can extrapolate from this data is that if you do have underlying conditions, you may be more greatly affected by COVID-19. But as I mentioned, this is a new entity where there are so many different manifestations of the disease, so we really can't say specifically how the disease itself will affect you. We have cases who have severe disease and seem to have sailed through without any problems. And there are also still the majority of us who are relatively healthy who could get this and have a very, very bad prognosis.
Okay, so that does bring up the other question then. If someone asks, if my child has asthma and they test positive for COVID-19, will my child have more respiratory problems even after the virus goes away?
So that's a good question. Again, as I mentioned, it depends on how the disease has affected you. Most of those patients that I've studied who've been affected with COVID, if the symptoms were mild and the manifestation was mild, so far the patients seem to have done okay. However, they also know that if you are affected by COVID in a bad way, meaning that you had ended up being intubated, or you really had some severe lung damage, then yes, you would have a prolonged recovery, and also even afterwards will have some problems. And they've seen this in some papers that came out from China, that certain adults who were normal to start with had normal lung function after they've had severe COVID infection, then would have lower lung function afterwards. And again, as I mentioned, it's a new disease. They will still have to follow these patients for a long time to see how this will affect them later on and what the
Okay.
prognosis would be.
All right. One parent asks, I was told inhalers, nebulizers, and humidifiers can make COVID-19 symptoms worse. Are these medications safe right now?
So that's really interesting. Some data came because some of these patients originally at the very beginning who were showing signs of difficulty were giving these asthma medications to help them breathe better. And then what they realized was if you had COVID and you are already infected, that using the nebulizers may help disperse the aerosols and may then infect other people.
Oh,
It doesn't necessarily means that it will make your symptoms worse, but that if you are COVID positive and you are obviously then you can be a spreader. If you use a nebulizer and there are other people beside you may then dispel the COVID virus much more. And so that's where that idea came from. But
got it. But
it's not
if
true that it will make your symptoms worse.
Okay, but for the people at home whose children do need their inhalers, their nebulizers, and the humidifiers, if their child needs it, though, they should still continue to
Oh,
use it
right,
unless their doctor tells them otherwise, correct?
definitely.
Okay.
In fact, you can use your nebulizer. Even if you have COVID, you just make sure that you use it if possible, maybe outside in the open air, or if you're going to use it in an enclosed room, that nobody would use that room at least for a couple of hours.
Okay. Okay. Another parent asks, my son is an allergic asthmatic. Should I be concerned since he almost daily has some kind of allergy?
Well, so the important thing is that whatever comorbidity you have, and if you have medications to try and control them, that you have to be consistent and be compliant. This way, you know that in case you have other new symptoms, then you may say, well, I've been compliant. Maybe this is something else that may which make you trigger whether you need to go see your doctor or not. The fact that you have allergies, as I mentioned, doesn't mean anything as long as you try to take your medications to control them. It doesn't necessarily mean that just because you have allergies, you are more prone to get a COVID infection.
Um, Someone else asks, could you give us the symptoms to be concerned or to look out for regarding COVID-19 for those who have respiratory issues like asthma or genetic defects related to the trachea?
So COVID-19 in the data that we've all seen seems to have a lot of different manifestations. There are some group wherein it doesn't present with anything. And in fact, these are what they call the silent spreaders who don't know they have the disease. They're called asymptomatic. They have no symptoms whatsoever. There's the small group wherein you have mild symptoms, cough, cold, congestion, sore throat. And then that can progress to patients who have fever. And then obviously on the extreme fine, it would be patients who present with respiratory distress, shortness of breath. So you could be in you can manifest yourself in anyone along the spectrum. The most important thing is that if you do present with more severe disease or severe symptoms, that you should probably need to seek help because that may mean that you may need further intervention.
The other big bucket of questions, Dr. Roberto, concerns masks. It's all over the news. It's all the health departments are saying, please wear your mask. All of us here at work, we have to wear our masks if we can't social distance. So let's start on some of these. Should kids with asthma wear masks? And if so, which ages should they start at?
Well, the guidelines do say that really one of the best way to help decrease the spread of the disease is to wear a mask, because what it does, it really helps you prevent the dispersion of these particles. So it is really advisable that everybody should wear masks if possible, as much as possible. And not only to wear masks, but to wear the mask correctly. I've seen people use it as a chin strap. I've seen people use it like this, and you're not doing. And I mean, if you're doing this, you might as well not wear the mask, because you're not helping anyone. If you really have to use the mask, you have to protect not only yourself but also the other people. And so that means you try to prevent dispersion of the particles. And so the closer you have it to your nose and closer to your face, and you try to pinch this area, then you can prevent inhaling the particles and also at the same time dispersing the particles. Of course, it's not 100% guarantee that you're not going to get it, because of course you're still able to breathe. However, the the more that you use it, the more everybody use it, the better it is, because then you will really have decreased absorption and dispersion of these particles.
So then the question is, I know that the guidelines that the CDC issued, and even here at Valley Children's, it's 2 and up. But for kids who are younger, there was someone who says, my son is 1, may need to go to daycare. My daughter is in pre-kindergarten. Are face shields good options for both, especially for her son who might be too young to wear a mask?
So it's not optimum, but I've seen this also in some nurseries where they have put face shields on babies, and it's one way of actually at least protecting them, because then the shield will help stop if there are any aerosols in the way.
So what about for people who are worried that a mask might make their children with asthma have a harder time breathing? Will it trigger an asthma attack or an
So
episode?
the fact that you're wearing a mask, and if you're wearing it correctly, it should be a little bit harder to breathe. That's a given. But it should not trigger an asthma attack. Most patients who feel that they trigger an asthma attack is probably more likely either having an anxiety episode where they feel a little bit claustrophobic. But it's, rest be assured, you should be getting enough oxygen, even if you are wearing a very, very tight mask, such as the case of the people, the health professionals who wear an N95 mask, which is supposed to at least decrease 95% of those particles, which is really tighter. You still are able to breathe, and most of these patients have normal oxygen saturation.
Okay, that's good to know. Um, let's see. So there is someone else who asks, will wearing a face mask all day at school affect my child? So you've already said that it might be a little bit tiny bit harder to breathe, but it shouldn't trigger anything. But what about wearing face masks all day if we finally hopefully get to that point where children are in school all day long and probably going to be required to wear masks?
Well, I can only answer for myself, because we work here in the hospital and we wear the face mask almost 20, well, not 24 hours, the moment we set into the hospital until we get home, which is about 8 hours, 9 hours. And I'm assuming that's almost the same amount, if ever, most of these children will be. As I mentioned, it should be maybe a little bit harder to breathe, but after a while you get used to it. It will not affect your breathing.
I know that Dr. Mason and last time had said it's probably a good idea for people at home with small kids to have their children start getting used to wearing a mask. Do you think it's okay to start them like maybe half an hour here, an hour there? Is that a good idea to get them acclimated
Yes,
and used to it?
just for them to get used to it and even playing around with it, so that it's not something that keep on pulling off. Especially if you're going to be taking them outside. Obviously, you're not wearing a mask when you're sleeping. You're not wearing a mask, when you're eating at home, because you are the confines of your home and you're in confines of your family. Who you all assume have no exposure.
Okay, someone asks, my child was born premature and experiencing wheezing. uses a nebulizer when he is under the weather. Would he be considered higher risk? You kind of answered this earlier, but this is a specific to a premature baby. Would he be considered higher risk for COVID-19 because he was born premature?
So when they analyze some of the data that came from some Europe and some from here, and they analyze the data of those patients who were hospitalized, it looked like the more severe patients who were hospitalized were those who were younger, like about less than 1 year of age, and became less until you became a little bit older. So yes, if you are a small baby and you are premature, again, because you do already have some chronic lung issues, you may be a higher risk of developing a more severe disease rather than being asymptomatic.
Okay. Another worried parent says, when my son gets a bad cough, he usually gets bronchitis and it takes him weeks to feel better. Can COVID-19 affect his lungs and become worse because of his bronchial issues?
So just because you've had, as I mentioned, chronic bronchitis, except for that example, or your child always seems to get a cough, it seems to be diagnosed as bronchitis. Again, it depends on how the COVID-19 can manifest in your child. As I mentioned, the good thing is that for children, even though they can be affected, it looks like in the majority of the data, they seem to be less severe compared to adults. But that doesn't entirely take out the risk that they can develop severe disease. As you know, in all this data, there are about 50% of those patients who have had severe disease and even mortality have had no underlying disorder. So it can and it does affect everyone, regardless of your health status, regardless of your age. Just do not be deceived in thinking that since you are in the less high risk group that you will not get it. You should not play with your life that way. It, as I mentioned, can affect very, very young children. And of course, uh, we've known of the cases of the older patients being affected, but it can affect everyone.
Okay, for those of you just joining us, this is Valley Children's Virtual Health Series, joined today by pediatric pulmonologist, Dr. Lauro Roberto. You can go ahead and submit your questions on Facebook right now. Thank you for tuning in. Let's get to some questions people just asked. Someone said, if you get COVID and you recover, can you get it again?
So that's a good question. They don't know. They
Yeah.
they don't really know whether you have everlasting immunity from getting COVID. Is there a chance that you can get it again? I think they have some data that show that there are some couple of cases who seem to have had it, but they're not sure whether it's just COVID that hasn't completely recovered. It's a new disease, it's a new entity. We're still learning everything about it. And obviously, we do know that the virus also mutates. And so we don't know whether you can get a milder version later on.
Someone asks, my 4-year-old daughter has reactive airways disease. Is that considered high risk? What should I do to help protect her?
So the most important thing would be, if she is on any medication, is to make sure that she takes her chronic medications that she takes to control her symptoms. And number two, to wear the mask and try to wash her hands and do the social distancing.
Okay. Can you provide information, one parent asks, about COVID-19 and croup?
So again, we've had so COVID-19 is caused by a coronavirus, but a new novel mutation similar to the one that causes severe respiratory disease. But there's also some coronaviruses in the past that we've had, which are milder viruses, also under the coronavirus, which can cause croup. And so, can this present itself as croup? It may, but it looks like most of the time, coronavirus itself can cause a more severe disease, or it can also be mild in the sense of there are some patients who are asymptomatic.
Okay. Someone says, my 10-year-old has Down syndrome and is prone to respiratory infections. He's had a few ED visits because of severe severe croup attacks. Does his medical history make him more prone to complications should he get COVID-19?
So as I mentioned, looks like most patients who do have underlying comorbidities are more prone to having severe disease. So if you do have Down syndrome, some of them also have heart issues. And again, that is another comorbidity that seems to affect patients much, much worse, especially in the adult population. And I've seen that also in younger children. So yes, her child, especially if he has two comorbidities like obesity or heart issues, or even let's say asthma, can then compound his risk of having a worse outcome if he did have COVID-19.
Okay. This just came through on Facebook. Someone says, going to the doctor, they tried to enforce me to put a mask on my 8-month-old. I always decline. Does the baby need a mask?
Yes, everybody needs to be protected. Just because I mentioned, not just because it's a baby doesn't mean they're not going to get it. In the data, in fact, it was those less than 1 year old who seemed to have done, or who were admitted who also had severe disease compared to those who were a little bit older.
So what kind of face protection or what kind of protection though can you put on a baby if a baby can't really?
True. You can try to put a mask. You can try to put a little bit of maybe a covering, or sometimes, as I mentioned, I've seen them where they put face shields to cover these infants.
Okay. And this is a question I asked you before we even started because I can't tell, because I have asthma. My son, one of my 2 kids has asthma, and there are questions coming in saying, how can I differentiate, if you can, between an asthma cough versus a COVID cough? This parent writes, my son normally has a minor cough due to asthma, and sometimes people hear him cough and then they worry. And then she starts to worry with everything going on. So maybe just a quick breakdown of how do you, I cough and my son cough, especially with the wildfires burning to our west. Lately, we've been seeming to cough all the time.
So if you have asthma and you do have medication, it's really important to be compliant during this time to try and control your symptoms so that you know that when you're having some coughing, it's not only because you've stopped taking your medications. So, and this is something new. The other thing too is that if you do have COVID and you start presenting COVID signs of coughing and congestion, one of the other major symptoms that we also see is still fever. And also, as I mentioned, you can also start feeling short of breath, which is another major symptom that you see in patients with COVID. But just because you don't show any sign of this doesn't mean that you do not have COVID. As I mentioned early on, there are many ways that COVID itself can manifest itself. There are some who are silent spreaders who have no symptoms whatsoever, and those who just have mild symptoms. For example, let's say you have asthma and your asthma is pretty well controlled. And then all of a sudden you started coughing and you're having a sore throat or a tickle in your throat and you're feeling congested. Now, if you had a history of exposure to someone, or if you start showing signs of having a little bit of fever, then you probably should have to be tested and then you have to worry. But if you already know that you have occasional coughing here and there, and then that you know that these are your regular symptoms, then you can probably just watch yourself and see. Oh, I can't hear you.
Oh, sorry. There you go. Yeah, thank you for that. Someone else asks, my daughter has been hospitalized 3 times with RSV because it has affected her asthma oxygen levels so badly. Are RSV and COVID similar in the way that they act in the body?
Today, COVID is worse. Yes, RSV can also kill, but COVID has a worse presentation in the lungs. Um, some of those CT scans of adult patients that have been infected with COVID have shown a lung that's almost fully destroyed. And so, in fact, if you have a patient with RSV who over time, let's say, got better, normally your lung function would return eventually. Those patients who have had COVID and where their whole lungs seem to have been destroyed, some of them still recover, but I think as they continue to follow these patients, you'll notice that they may have less lung function just because of the effects of COVID. Again, a new disease with so many different manifestations on how it affects people. That's why we all have to be very careful and diligent in trying to avoid this.
Okay, someone else just wrote, does Flovent actually lower the immune system and make it more likely to get COVID?
I'm sorry, does COVID make you more likely?
Does Flovent?
Oh, so
What is Flovent for some people who don't know what that is?
Flovent is an inhaled steroid.
Okay.
And we actually use that as a controller for patients with asthma. So that's an interesting question, because there was some data that was showing that for some patients who have had bad COVID, they were being started on a steroid to help decrease some of the inflammation caused by COVID. There are some data, which I'm not sure whether it's been proven or not, that showed that patients who were using inhaled steroids seem to have done better actually rather than worse with COVID. Again, these are all just data coming out, whether it's going to be true or not, which has to be followed. But as far as we know right now, Flovent or inhaled steroids may not adversely affect patients with COVID.
Okay. Someone just submitted a question here. If our children have to go back to school and they have to wear a mask the whole day, how many times should they be changing their masks, or would they only need to change it if they cough or sneeze into it?
So that's a good question. If we had unlimited resources, it would be nice to be able to change it, let's say, after a day. Most likely you should be able to change it after a day. But let's say if you sneeze each time, then yes, you may want to remove that and change with something else. But again, that depends on your accessibility to this protective gear. Most of the time we used for our case here, we try to use the mask until we get home and we don't need it anymore and disperse of it as we need to. But we try to keep it as much as possible from being, obviously, if you have been exposed to someone that you thought has COVID, then you need to, the moment you are outside of that room, we to get rid of that mask and get a new one.
Okay. Again, for those of you who are just tuning in to our Facebook Live, this is our latest edition of our virtual health series for families, joined today by pediatric pulmonologist, Dr. Lauro Roberto. So please feel free in the comments to ask your questions. He is here to answer any and all of them the best he can. As Dr. Roberto mentioned a few times earlier, this disease it's new. It's pretty new. And so we're still learning a lot. And sometimes right now the answer is, I'm not sure yet, but we're keeping an eye on it. So continue to submit your questions to us via Facebook. This one came in just now. This one's a little longer, Dr. Roberto. We were at Valley Children's last night, is what this parent says. My 3-year-old is asthmatic and tested for COVID. I was given the impression by the nurse assistant that every time my son comes in for asthma, he will also need to get tested for COVID. I know in the winter, I need to get his treatments once or twice a week sometimes. I am concerned he is wrongfully diagnosed. Can you help clarify? I know we can't talk specifically about this particular parent's diagnosis, maybe necessarily, but I don't know, that's an interesting one. Do you have any insight on kids who come in for asthma treatments? Will they need to be tested for COVID also?
So I think the hospital policy is if you are, let me rephrase this. So you don't need to be tested for COVID if you have to be seen in the clinic unless you have symptoms.
Yes.
If your child is having fever, new onset respiratory issues, and then we're going to be seeing you, then yes, probably need to be tested before you get seen. Just because you have respiratory issues all the time doesn't necessarily mean that you have asthma. It could be other things that can cause that. I hope that answers her question.
Okay. And then just for those of you watching at home, Valley Children's does test all children before surgeries and certain procedures just to ensure that they are COVID-free for their protection, their family's protection, as well as the physicians and the staff here. So for those of you at home watching, and you have to come in for a procedure or a surgery, just know that your child will be tested before the final go-ahead for your surgery. Something someone else is asking, My 1-year-old has had a fever for 2.5 days, just started a minor cough. Should I get him tested?
So the best way would be, there are other things in a 1-year-old that can cause fever and a cough. It may just be another viral infection, or again, unless you know that your 1-year-old has been exposed to somebody at home with COVID, that would make raise the alarm for you. I mean, 1-year-olds hardly I mean, usually if they're going to have any exposure, it will be to somebody else at home for COVID, right? So, but also it's true that children at this age are more prone to have a lot of viral infections. So not all viral infection that cause fever and coughing is COVID. But if the patient is showing other signs and symptoms, and let's say progressively, let's say getting worse or other more shortness of breath, then you may want to have him be evaluated by his primary doctor and see whether he needs to be tested for COVID.
So I do know that here at Valley Children's in our emergency department, a lot of families are coming in, no symptoms, no real close exposure, and they want to get tested. And the staff has said, make sure, obviously, come to Valley Children's emergency department if you need medical treatment. But the first call should always be to your primary care provider. And then also, just for those of you, again, watching at home, if you go to our website, valleychildrens.org/COVID-19, you will see that we list resources in all of the counties we serve in the Central Valley and can direct you to testing sites that are low cost or no cost as well. So, because that's the big fear, Dr. Roberto. People say, oh, my child is coughing. I better rush to the emergency department. But that shouldn't always be number one, right?
Right. I think you need to balance it and saying, okay, did I have exposure? Did the child have exposure? Are the symptoms very different from what it's been before? Even though I do mention that there are so many different manifestations, and he may actually have COVID or not, because he may be one of those who are mild, but not necessarily just because he has fever and cough is this going to be COVID.
Okay. Another parent says, my daughter has been diagnosed with asthma and bronchitis.
Bronchitis, yes.
Yes. Thank you for knowing, even though I did not pronounce that right. Is it better to just keep her at home? In the past, she only had asthma attached when she's contracted a virus such as a cold and the flu, but it has caused her to be intubated in the past as well.
So we're talking about the patients who seem to have had some history of intubation, and the fact that she does have bronchitis may predispose her to have more chronic lung disorders, that if she does have a viral infection or any other infection, it may cause her to have more symptoms. So if her question is, would it be safer or better for her to stay at home? Well, obviously that would be because then you would decrease the exposure to viruses. And so then maybe keep her healthier.
Someone asks if Clovis Unified allows kids to come back. This is probably a question for any child or any parent with a child who is school age right now. If Clovis Unified, or insert your own school district here, allows kids to come back into the classroom, is it okay to send them back?
So that would, I guess, depend on what the county or the district recommendations are. I mean, as a pulmonologist, obviously I worry about children who have asthma and their exposure. And we do know that the best way to prevent yourself from being exposed is by wearing a mask and social distancing. Whether the reality of that in a 4-year-old or a 5-year-old or a 6-year-old, whether how well that could happen, of course, is everyone's guess. So I cannot tell you what to do, but I can tell you that, yes, if they have to go to school, then, really appropriate measures should be made. And you should talk with your school district, because really, it's really important to do that social distancing at the same time, the face covering.
So what about somebody, there's another parent who says, should I allow my child to go back to school if he has had a heart transplant?
So if you've had a heart transplant, you're probably on strong immunosuppressives, um, you probably should be at home and really be very wary of exposure because you're really at a high risk. And again, I also don't know at what level, whether you are fine right now or you're still going to have to undergo other surgeries. But in the cases that they have seen, patients who have not done well are those who have had, as I mentioned, not only respiratory disorders, but cardiac disorders, neurological disorders.
Okay. Someone asks, I have a question for ALCappa cases in congenital heart disease. What is the gravity of severity if they catch COVID or mitral regurgitation?
So again, most cases that have had more severe disease seem to be those patients who have, as I mentioned, not only respiratory, but cardiac disorders. So that being said, then, the risk may be higher for them.
Okay. Okay. Someone says, my daughter is a gene carrier of cystic fibrosis. Should I keep her at home from school? She also has asthma.
So if you are, again, if you are just a carrier and you do not have CF, then you do not have CF. You're just a carrier. And again, then the same precautions apply if you have asthma or not. As I mentioned, um, most of those cases that they found out, the most common underlying disease is asthma. But that doesn't mean that just because you have asthma, the risk of contracting the disease is increased. The risk of contracting the disease is the same for everyone, but whether it affects you or not worse, maybe there's a slight worse tendency if you have asthma.
Okay. Someone else asks, how long does it take to start showing symptoms of COVID-19?
So it looks like the incubation period is about 3 days, 3 to 5 days. But that being said, they've also had cases that will take as long as about 11 to 13 days. That's why we have the 2 week protocol of quarantine patients. They can start showing signs and symptoms early on, but there are some milder ones who would show much later on, like around 2 weeks later.
Someone says, my son has asthma, hasn't been out of the house very often during this pandemic, easily susceptible to pneumonia. We would like to take him on a beach camping trip. Would that be okay?
So again, I don't know where this place is going to be, but I mean, if you are able to, not really guaranteed, but able to make sure that you're doing safe social distancing, decrease your exposure, wearing the mask if possible, especially in when you are going to be in an area where there's a lot of people. I don't see why not.
Okay. Let's see. Someone asked, is the current hospital visitor policy one or two parents? I can answer this one. Just for, for those of you watching at home, yes, currently Valley Children's visitor policy at all of our locations. So whether you're at the hospital, one of our specialty care centers, one of our primary care offices, or our urgent care center, it is one parent or guardian per child per visit. There are rare exceptions made in our inpatient hospital unit, but again, those are very, very rare. The visitor policy, again, throughout our entire network at all Valley Children's buildings is one parent or guardian per child. Not ideal. So we thank everybody for being patient and compliant. We also have a universal masking policy. So parents, you have to wear a mask. If you don't have one, it's okay. We will give you one. And then children older than 2 are asked to wear a mask as well. But obviously, if there are conditions that dictate your child cannot wear one, then that's okay. That's okay. But again, those are the exceptions, not the rule. Okay, a question for you now. It sounds like this is somebody who just tuned in. You did answer this earlier, but in case people are just tuning in, Dr. Roberto, is it safe to be wearing a mask all day at school? And is it true that the gases you exhale in your mask are bad?
So we inhale oxygen and we exhale carbon dioxide. But that being said, the carbon dioxide still gets exhaled outside and you're still getting oxygen. So you can wear a mask every day, as we do. We've been doing it since we all started for as long as about 8 or 9 hours a day.
Yeah, there seems to be, you see on social media, and we tell people all the time, even on our own social media accounts, Dr. Roberto, don't believe everything that people are saying on social media, because the vast majority of mask wearers are able to do so safely for hours at a time, correct?
Yes.
Okay. Someone is asking too, and I'm not sure. So if a patient tests positive for COVID-19 here at Valley Children's, do they have to stay in the hospital alone without a parent? No, we have safety measures in place. We have gear for those families.
Right.
So in the rare event that a parent's child is in our hospital with COVID-19, no, we take every precaution in place to not only ensure that the parents are safe, but the staff, and that the parent can be at the bedside. Something that came in, what safety precautions should be taken for someone new moving into your house if you have a child with asthma?
So I guess the question is, if the person can quarantine themselves before they move in, then it'll be happy, then you'll be at least that they're not COVID positive, or at least have them tested anyway before they come in. That way, it's a universal precaution against everyone, I think, not just for anybody with asthma.
Okay. And then this is kind of a broad question, but we have been seeing this a lot. Parents are desperate for any kind of advice you can give them. Again, for kids with chronic respiratory illnesses and are very worried about COVID-19, what advice do you have for those worried moms and dads?
If these patients have chronic lung disorders and they have medications, please be compliant and use these medications now more than ever, just to make sure that their symptoms are better controlled. And then 2, practice universal precautions of trying to prevent this: wearing a mask, doing social distancing, washing your hands really well. Those are the 3 major guidelines that we can probably offer them.
Okay. This one just came in. My daughter has pulmonary hypoplasia, PCD, and is hospitalized several times a year. When will lung function tests be allowed to be done in office visits? And are lung function tests even being done at the hospital? She hasn't had one since the COVID pandemic started.
So we are doing lung function tests here already. We just have to make sure, obviously, that patients are asymptomatic when we do the testing. And we are very safe in following guidelines. When we do the breathing test for these patients, we don't use that room until about a couple of hours after, to make sure that it's safe for everyone.
Dr. Roberto, some of our other pediatric specialties have been doing some appointments, if possible, via telehealth, telemedicine. Has a pulmonology, have the other pulmonologists or you been able to provide any of those via telehealth for patients yet?
Yeah, since the beginning of this pandemic, we have been doing both telemedicine, and we've also been seeing patients here in our clinic. And in fact, patients, when they are called to schedule their appointments, are given a choice whether they want to come in or whether they want to do the visit via telemedicine.
And what do you want to tell people who might be worried? Because we do hear this a lot from parents. I don't know if I feel safe going into the doctor's office. So what do you want to say to them if they do have an appointment coming up in either one of our facilities or at one of the many primary care providers we work with throughout the communities, if they might be scared to go to the doctor?
Well, it's a normal, what do you call this? It's a normal fear, especially because you're going to be exposing yourself not only to the outside world, to the population, but also to a population probably is a little bit more high risk that you fear may have more diseases. That being said, we do, and you know this very well, Zara, how much we take care of our own people, and so that we actually do a lot of testing in order for us to be able to work here. We get our temperature tested every day. We wear the appropriate mask and face shield. In fact, and when we see patients, I wear an N95 mask, a face shield, and a gown to make sure that I do not expose them to anything.
Yeah, that's something that we've tried to get out to the community. If you're going to go anywhere, Valley Children's is a good place because we are
Probably
doing health.
safer.
Yeah, we are doing health checks, temperature checks, masks, face shields,
And with your
and
mask,
everything. Yeah. So for people who are watching at home, the only reason Dr. Roberto and I aren't wearing the gear is because we are in our offices with the doors closed, but we have it ready should somebody
yes,
walk in.
we have goggles,
Exactly.
we have masks, I have a gown. Yeah.
Exactly. One
We,
person does have a mask question. Someone says, my son likes to sometimes lick his mask when he's wearing it. So once the mask is wet, should I be changing it?
yes, please. And please try to tell him not to lick the mask if it's possible, because it just makes it wet and more prone to sticking to the skin. And you know the skin also has flora or bacterial flora, so you really don't want that.
Okay. This question sounds like it might be from a school nurse or somebody at a campus. If we give a student with asthma an inhaler at school, what should we do when the student needs to use it and exhale the medicine?
So that's a good question. Um, in fact, what they found out was that's why there was an ad. That's what they found out was that when these patients with COVID were and they were trying to aerosolize them, was dispersing the aerosols. So they switched from using the aerosols to using the spacer itself, which is a little bit safer because then they can exhale straight to the tube.
Okay. Sorry, I'm looking something up because someone just asked, do you at Valley Children's have cases of kids with COVID-19? So I'm actually, we get updated every day on this. And so, yes, we have. And so so again, Valley Children's has run thousands of tests on children since this pandemic began. The vast majority of those cases, those kids were sent home. A very small number required a higher level of care. I'm trying to look up the exact numbers right now. I can't get to it. I'm trying to do both at once, but yeah, Dr. Roberto, people sometimes like to pull out the whole, oh, it's not affecting kids card, but that's not true.
No, no. Most data have shown that even though kids may not be as affected as adults, do not be deceived in thinking that this will spare them. Also, do not be deceived in thinking that just because you don't have any underlying condition, that it will not affect you in a bad way. We know, I mean, 50% of the cases that they have admitted who also have turned out to be critically ill have had no underlying conditions whatsoever.
Yeah, it's we've seen them.
Oh yes,
We've seen them here.
this is true. This is true. It's not. It this is true. It happens all over the world. Children are being affected. Maybe not to the same degree as adults, and they're still trying to find out why. But they're still being affected, and they're still dying.
Okay. And then one last one for you. Should my child with asthma wear a medical mask, or is a homemade mask okay?
So the guidelines right now is well for the state is to wear the face mask or a hand face mask. I mean, obviously, you cannot say there are no studies done on what kind of material you've used and whether that would be more protective than a surgical mask, for example. If you have the capability of getting a surgical mask, I think that's great. But I think a mask in general, as long as you're using it appropriately, and as I mentioned, not just covering your chin or just below your nose. If you're using it appropriately, I think will be protective.
Okay, and then one more just came in. See, this is a hot topic, Dr. Roberto. Can you discuss aerosolization and the dangers of someone coming into your home without a mask?
So first, for aerosolization, in fact, they know that, as I mentioned, what they found out in those patients who have COVID already, that if you do aerosolize medications, that you may disperse the viral particles. And so that may cause you to have more dispersion. And so it's be high risk. That's why they try to avoid that and just use the spacer. And then, what's the other question again?
The dangers of someone coming into your house without a mask on.
So You don't know whether that person has COVID or not. So, those asymptomatic patients who are spreaders, when they when they when they study them, they had the same viral load as those patients who have severe disease. So they can still give you, it's not affecting them, but it may affect you. So how would you know? You know, why would you take that risk?
Okay. Okay. And just so you know, Dr. Roberto, there have also been several people on Facebook who are saying thank you to you for taking the time to answer all of their questions. So,
We're more than happy. I mean, we're valid children. We take
all
care
right.
of their children.
Dr. Roberto, thank you again so much for your time. It's very greatly appreciated. On behalf of parents of kids with asthma, I'm one of them. Thank you for kind of easing our worries and also answering our questions. We appreciate it.
Anytime. I just hope I was able to help appease them.
Yes, you definitely did. And for those of you at home, we're going to get some information up on the screen for you again. If you want to go to our website, you can go to valleychildrens.org/COVID-19. You will find a plethora of information there to help you, including where to go to get tested, when to call your primary care provider, symptom trackers, so you can put in your symptoms and see, maybe I should get tested, and where you should go if you have any questions. You can also, during business hours, call the Valley Children's COVID-19 hotline. The toll-free number is on your screen there, 888-286-9336, 286-9336. The local number, 353, and a bunch of threes after that, 559-353-3333. Wear your masks, wash your hands, and thank you again, and tune in for our next edition in the next week.